name is Lauren Stanley. I'm a nursing student at UAM. I'm just going to be administering a cleansing enema on you today. Can I get you to go ahead and verify your name and your date of birth for me? Okay, so that is the correct name and date of birth. So what I'm going to be doing today is I'm just going to be sticking about 2 to 3 inches of a tube in your rectum, and some solution is going to go in, and then I'm going to take it out, and you're just going to hold it in there for about 5 to 15 minutes. So before we begin, I'm going to make sure that I have a bedpan nearby. I'm going to go ahead and open up my kit. Okay. So I have here with me 500 milliliters of warm water. It's been heated to 105 degrees. So the first thing I'm going to do is make sure that my clamp is closed. As you can see, I'm going to hold this up and open it. I'm going to pour in the 500 milliliters of warm water. After that's been added in, I'm just going to set that to the side. And I'm going to open up the soap. And I'm going to put that in there as well. Okay, I'm going to dispose of this in a biohazard bag. After that, I'm going to take my bag over here and hang it off the IV pole. I have a sink right here, so I'm just going to go ahead and take off the cap and hold my tube over the sink. Make sure that the solution is flowing freely. After it started coming out, I'm going to go ahead and clamp it again. Just going to let that hang. I'm going to come back over here, and I'm going to dispose of these gloves and perform hand hygiene and put on a new pair of gloves. Okay. So after that, I'm going to go ahead and tell my patient that they are going to be lying on their left side with their right knee flexed. So I'm going to go ahead and assist them with that. After that, I'm going to go ahead and drape them again. I'm going to get my waterproof pad. I'm going to place it under the patient. Okay, so after I've done that, I'm going to make sure that the tip of my enema is lubricated, as you can see. Okay, so I'm going to tell my patient to go ahead and take some deep breaths in. And I'm going to insert this 7 to 10 centimeters. After that, I'm going to grab my bag and I'm going to hold it level with the patient's hips. And I'm going to wait until the correct amount of solution is inserted after I unclamp the drainage. I'm going to wait until the correct amount of solution has been inserted. After that, I'm going to reclamp the tube. I'm going to instruct the patient to go ahead and again take deep breaths as I take out the enema. Okay. If there is stool on the end of the tube, you're going to go ahead and get a wipe or toilet paper, and you're going to wrap the end of the tube in that. I'm going to go ahead and discard this in the biohazard bag. I'm going to get some wipes or warm soap and water. I'm going to go ahead and clean the rectal area. After that, I'm going to dispose of that. And I'm going to cover the patient and instruct them to hold that for 5 to 15 minutes. I'm going to give them the call light if there's anything that they need. As they're doing that, I'm going to go ahead and dispose of all of my supplies in the biohazard bag. And I'm going to take off my gloves and perform hand hygiene. And I'm going to let my patient know that if they feel the need to defecate, since my patient is mobile, I'm going to assist them to the toilet. After they have defecated, I'll assist them back to bed, and I'll note the color, consistency, and quantity of the stool. And that's it.